In this tutorial we're going to be talking about core strength for low back pain. So what we're going to do is we're first going to sort of better understand what core strength is and a few other types of core training. So what we can then do is make it much easier to apply it to how we use it for lower back pain, or how we don't use it for lower back pain, because there is a time and a place for it, and there is also a time and a place where we don't need to use it. So we're going to sort of discuss that as we move through. So again, being a little bit of a purist, we're going to look at how we would understand core strength. So if we take the word strength and look at the definition of it, strength is the ability of a muscle or a group of muscles to contract with maximum force in one repetition, or one time, if you will. And obviously we're talking about core, so it's the ability of the core muscles to contract, contract using maximal force. What we've then got is core endurance, which is something that in some respects kind of gets lost in core strength and in core stability. It's a term that's kind of been coined by Dr Stuart McGill, and it's the determining factor or most effective type of training to be able to reduce lower back pain, or at least mitigate it, and help rehabilitate it is probably the best way to describe it. So we basically then, same core muscles that we're talking about, but we're now talking about endurance. So this is now a sub-maximal force, but over time and against fatigue. So we're not talking about, so strength is one maximal contraction of the muscles. Endurance is lots of smaller contractions of the same muscles over a prolonged period of time. So we can start to see from core strength to core endurance, there is a difference. Then if we move on to the next one, which is core stability, what we've then got is again a slightly different definition. So with regards to core stability, it's not necessarily the core being stable, but we are looking for different parts of the core to be stable, and there is a way that we do that. So we've got the spine. So if we've got spine stability, if we want the spine to be stable, we need the muscles of the core to contract at the correct time. So this is more about the timing of the muscle, and if we then look at the muscles of the hip and the shoulder, it's the smoothness of movement, it's the coordination, and it's the timing of those muscles to be able to do it at the right time. So we've got strength, which is a maximal maximal contraction of those muscles one time. Endurance is lots of submaximal over a period of time, and then you've got core stability, which is just the initial timing. Do these muscles contract at the right time, or do they do it a split second too late, or so on and so forth? So you can now start to see that there is a slight difference in how we determine the type of training that we're doing. What we can also start to do from this is start to select exercises accordingly. So what we've got to do when we're talking about low back pain is, when we are selecting exercises, we don't just select them randomly, and we don't just say a broad rehabilitational coaching principle of you need to strengthen your core, you need to improve your core stability, whatever it might be. Because again, when people come to me, the general position they are in, they've had low back pain for a long time, they've possibly seen other people, other professionals, the treatment that they've had hasn't worked, they have potentially been told to strengthen their core, improve their core stability, whatever it might be, strengthen their lower back is another one, and they aren't working. Now what this generally comes down to is they haven't had a proper consultation, or they've had an inadequate consultation, they haven't been asked enough questions and understood, or the professional hasn't understood the back pain well enough to then be able to determine, do they need core strength, do they need core endurance, or do they need core stability? So we can then go through choosing the correct exercise for that. So if we go back to core strength, and if the individual, so if we were to understand that the individual has a pain trigger of lifting heavy objects, and one of the parts of the lifting is they need to put it on a shelf, so they need to move it away from their body, and as they move it away from their body, it's then creating and triggering the pain. So what that involves, so the core, if it's a heavy object, so when we have a heavy object to lift, the core needs to be strong, because we need to brace the abdominals, and that is then in a sense squeezing tightly around the spine. So we've got a core strengthening issue in the fact that it doesn't like that compression around, or that amount of compression around the spine, because it's squashing the spine too much. The muscular tension is too much for that spine to manage, and it's triggering pain. So in that example, it wouldn't be useful to use core strengthening, because it's triggering their pain. It's making their pain worse. Now, on the flip side of that, if we go through a consultation and an adequate low back assessment, and we find out that it's the rounding of the back that triggers the pain, so they lift the weight from the floor, but they use a rounded spine. What we would do is we would get that spine in neutral. We would think about getting the hips moving so they can get into the position to be able to lift with the neutral spine. They can then brace their abdominals using that core strengthening, lift it, and then they move it away from their body. And again, we find out during this other person's self-assessment that moving it away from the body isn't triggers that. Go back to the start. So we've got a different individual. They can lift it from the floor, but what triggers their pain is the rounded spine. They can also move it away from their body, and it doesn't trigger their pain. So that's the second person. So it's not the compression around the spine that's causing the problem. It's the flexion of the spine. So we need to be able to determine that from the consultation and from the assessment. If we can do that, we know with the first person not to use core strengthening lifting exercises or core strengthening exercises where they put lots of compression around the spine, because that triggers their pain. But with the second person who can lift heavy objects with that compression, but we've just got to get them in a neutral spine position, we can start to use, or we have the ability to use, those core strengthening exercises. If we then take those two same people and move it into core endurance, this is going to be more effective for person A. So we need to make the objects lighter, and we also need to make them keep the load close to their body. So we would use a strategy of lifting the weight, but instead of using the arms to put it on the shelf, they need to walk forwards towards the shelf to get it on there, so they keep the weight close to their body. And then what we can then do, that keeps the submaximal element or bracing of the abdominals to it, because the weight is close to them. And then they can put the weight down and it doesn't trigger their pain. And then if we use the core stability, what we would do is we would then go down, pre-brace the abdominals, so we stabilize the spine, so we create that tension around the spine using that submaximal bracing. We would also unload the object slightly if that's possible. If we can't do that, we would need to get a second person in to be able to help lift it, so on and so forth. So we would then use core stability regarding the timing. So we pre-brace. We don't just naturally wait for it to happen. We pre-brace the abdominals submaximally, lift, and then pop it back on. Obviously, person two, all we need to focus on is maintaining that neutral spine. So we've got two examples of lower back pain which are different, or they have different triggers, so then we use different strategies to keep them pain-free. This all comes from the consultation and the assessment. This is the most important part when it comes to rehabilitating lower back pain. We would also use everyday movement. So in these examples, I haven't necessarily used exercise as the rehabilitation strategy. That could be a part of it, but what we would need to do first, because it's a part of their job, let's say, of lifting and moving these objects around, we need to make sure that they're able to do that. And then if they're able to do that and it doesn't trigger pain throughout the day, we can then start using exercise more therapeutically to enhance what they're doing in the day. So we can't just throw exercises at the problem, because we are, in a sense, we're building on a crumbling foundation. What we have to do is understand the individual's lower back pain. If we can understand the lower back pain, we can then start building the strategy of selecting the right type of use of the core and use of the spine that the person needs. Obviously, in this example, is it the compression around the spine that's causing the problem, or is it the flexed spine that's causing the problem? If it's the compression around the spine, we don't really want to be using core strengthening exercises to make that problem better, because it's not going to, because it causes the problem. But if it's the flexion of the spine, we can just think about range of movement at the hips, maintain the neutral spine, brace the abdominals with core strengthening exercises, and then move the weight accordingly. So we've got to think about it in that way. We can't, as I've mentioned, just throw exercises at it, because we might be choosing the wrong exercises. And if we've got professionals out there that are just throwing broad, ill-informed core strength, you need to improve your core strength, or you need to improve your core stability, or whatever, that's just as much of a problem as the problem itself, because they're just putting another problem on top of the problem that's already there. Whereas if we can do a proper consultation, a proper self-assessment, or proper lower back pain assessment, we can understand, do we need core strengthening? Do we need range of movement at the hips to maintain proper position of the spine? Do we need core endurance? Or do we need core stability? All of that will come out. So we aren't guessing. We're using the consultation and the assessment to choose exercises more, we're using a more informed and calculated decision-making process to select the correct exercises. What we would then do, obviously, is send them away, go about using that advice and those recommendations, put it into practice, come back a week or 2 weeks later, right, how did that feel? How did that work? Yes, it worked for the first 15-20 minutes, but then it started to fatigue. If it starts to fatigue, we then need to build the core endurance. So you can start to see there is a logic and an objectivity to the decisions that are being made, not just throwing out broad terms of you need to strengthen your core and you need to improve your core stability, because you might be building something that doesn't need to be built, and what is being built could be creating more of a problem than more of a solution. What we are trying to do is understand the problem. What happens then is within the problem, the solution, in a sense, shows itself, and then we put that into play. So, as I've mentioned over the years to so many people, I'm not choosing what needs to happen. I'm listening to your body, and your body is telling me what to do, because your body is telling a story. It's just using the language of movement and pain and all these other things that we cover in the consultation and in the assessment. And if we can get those right, your body will tell me everything that it needs, and then all I need to do is sort of empower you to understand that, so you know why you're doing what you're doing, and then I obviously need to give it to you to be able to do, and then we go through that sort of feedback loop of how's it going, how's it feeling, how is your body responding, so on and so forth, so we can then put in new and better, more updated recommendations and advice. So that is, in a sense, core strength for lower back pain. That's how we use it. It's not a done deal in that if you've got lower back pain you need to strengthen your core. It's not that way. As I've explained, there's a slight more nuance and context to it, which is what we need to find in the consultation and in the assessment. So hopefully that's been of help to you. Hopefully it's given you a better understanding potentially of your lower back pain, but also of a strategy that you need to take to be able to get to a point where your lower back pain starts to improve. So many thanks for watching. My name is Chris from Chris for Whole Training. I'll speak to you in the next tutorial.